Okay, so welcome to this lecture on Module 2A that discusses the overview of the different caregiving settings that you may find yourself working in. So now, there are different types of caregivers, just as there are different types of caregiving settings. And most seniors, most elderly people would prefer to age in place, meaning they would prefer to age within the comfort of their own homes, all things equal. But the truth is, for many of these elderly people, aging at home safely and comfortably really may not be feasible without extra help. That is where you, the caregiver, come in. And the different types of caregivers will generally fall into two broad categories. The first being the informal caregivers, and the second being the professional caregivers. Informal caregivers could include family members, volunteers who will just come to help the elderly man or woman be able to have the basic daily living needs that they would need. And they would usually offer companionship or just light housekeeping here and there. But on the other hand, professional caregivers refer to a broad variety of trained health personnel or trained allied health personnel, each with their own unique skills and requirements. So the various type of caregivers include adult daycare facility caregivers. That's like the same way we have daycare for children. There are also some daycare for adults. So the caregivers of such facilities come and close at the end of the day when the adults are taken back to their various homes. Then agency caregivers, this would operate as staffs of a caregiving agency. Then assisted living facility caregivers. There are some facilities for assisted living. There are such inpatients are usually very, very old. They cannot stay in their own home unassisted. They probably do not have children who will be able to cater to their needs. As such, they are brought to assisted living facilities. Then caregivers are employed to work within such facilities. There's also certified nursing assistants. Some of this would also offer caregiving aids. Family caregivers are employed within the home to provide caregiving needs to either an adult or a child who needs such. Then home health aides, usually also employed within the home to provide caregiving needs. Hospice and palliative are for end of life. Those are persons struggling with terminal conditions who have less than 6 months to live generally. So usually they are kept in hospice facilities or sometimes within the comfort of their own home. So caregivers are employed for such aim of providing just end of life comfort, end of life companionship for such individuals. Then independent caregivers are those who would work on their own. They're not affiliated to any agency. They're not affiliated with any facility. They just render their own services on their own terms. Then informal caregivers are also another type of caregivers. There's some non-medical caregivers. They're personal care attendants, private duty, usually for the high-profile families, so to say, the very elites. Then senior facility caregivers. There are some facilities that are almost like the elderly home. So some caregivers may be employed to work in such facilities. Then skilled nursing home caregivers. Virtual caregivers will provide caregiving needs with the aid of telemedia. That could be via internet connection, through phone, through system. Usually that will be things like reminder to take medications and just some basic needs, not the intense needs that some elderly people would require. Then volunteer caregivers are just persons who would voluntarily out of their own will decide to offer caregiving needs to persons who may need such. Now, the adult daycare facility caregivers, they would usually provide medical care, supervision, education, and even social support for the elderly people and persons with disabilities. And in addition, these facilities, they are an important source of social support for clients because elderly persons they are at risk of isolation, especially when they live alone. But the adult daycare facilities allow a number of elderly persons to come together daily. So they have the social support, they have the social network, they're able to interact with people of their own age brackets. So this type of caregivers would often provide transportation and supervision for outings. So there's a means of transportation that goes to get them from their house and takes them back to the house at the close of the day. Then if they have to go for outings, it's also the same daycare facilities that would provide such means of transportations and even other social activities, exercise, and the likes. Assisted living facility caregivers. This would usually provide care for seniors with both physical and many times cognitive ability. So that could be someone with dementia or with Alzheimer's, and they are admitted into an assisted living facility. So the caregivers in such places are the ones providing this need, such that the patients are able to live semi-independently, even though they may need extra help from nursing aides during the week. Now, certified nursing assistants will perform medically related tasks, such as vital signs, change of wound dressing, cleaning catheters. They would be able to control infections, and they'll be able to administer medications to the patients under prescriptions, of course. Now, unlike personal care aides and home health aides, certified nursing assistants may work under a registered nurse or a nurse practitioner's supervision. And certified nursing assistants may also work in rehabilitation homes. That could be rehabilitation from physical injuries. That could be rehabilitation homes from addictions, just post-war veterans. Such rehabilitation homes, certified nursing assistants could work there. They could also work in adult daycare centers, and they could also work in skilled nursing facilities. In fact, they can work in hospitals. So now home health aides would also provide personal care at home. However, they can also work in retirement communities, assisted living facilities, as I explained earlier, group homes, or other transitional homes. Transitional homes are like someone has a surgery, but it's not safe to move them to their own home unaided. Transitional homes are like where you have a number of persons who are not really needing the core medical care that would require them to be hospitalized. As such, they are in transitional homes where they just have the basic living needs, but aided by home health aides. Then when they are healthy enough to be moved or to be discharged to their own home, they can then go. So it's a home in transition. It's not a place for a prolonged stay or admission. Hospice and palliative caregivers will support comfort and quality of life for clients facing end-of-life conditions, like I said earlier, stage 4 cancer that has spread, and just conditions that medically are not reversible, are not curable, and prognosis give and take. The patient has 6 months or less to live. And this type of caregivers would also work very closely with families to ease their suffering, because having a relative and having to endure an end-of-life condition is psychologically a turmoil to the family. So the caregivers would also provide emotional support to the families of such clients. Independent caregivers would work in many private families. So most private families who are elite, so to say, will hire independent caregivers to deliver individualized in-home care. And the role focus is usually on relationship building and social connections to keep the client engaged and connected. And this type of caregivers often have more experience because it takes several years to be able to build the skills and the knowledge necessary to be able to work on your own. Informal caregivers will include family caregivers, but it also refers to a neighbor, a friend, a cousin, an auntie, a uncle, anyone with a personal relationship with a care recipient who volunteers their time, typically without pay, to be able to offer the needed care to such a patient. Non-medical caregivers refer to personal care attendants. They could be homemakers, they could be companions, could even be a spouse or other professionals who will provide low-touch support for seniors and disabled patients. And they would typically help with everyday homemaking, companion care activities such as cooking, cleaning, bathing, dressing, toileting, just the likes of things needed for daily living. Then personal care attendants, they'll provide care within the client's home. They will help with daily activities, eating, shopping, and the likes. And this type of caregivers are ideal for semi-independent older adults who would need moderate support. So the older adults are still able to do most things on their own, but they will just need a little support here and there. Private duty caregivers would provide support to seniors and their families through various services, including personal and nursing care, bill payments, transportation. And the aim of personal duty caregivers is to help their client retain their independence at home. Then senior facility caregivers would work with the elderly in nursing home to support their mental, physical, and emotional health. Now, outside of these agencies, often such staffs can work in large nursing homes and just, of course, still with the ultimate aim of providing the needed help that I highlighted earlier. So skilled nursing home caregivers would provide specialized care. It could be physiotherapy, it could be medical care, vital signs, glucose monitoring, medication administration, change of wound dressings, and the likes. And they would usually provide short-term services until the client's health has stabilized. Then the general caregiver can step in to provide continued care. Now, the virtual caregivers would usually provide their own services via telehealth with the aim of assisting patients who don't require physical support. So it could just be a reminder to take medications. It could be a routine call for emotional support. So these types of caregivers would routinely call or meet clients online to discuss their needs and challenges, provide medication reminders, guide them through in-home modifications that enhance their quality of life. And some virtual caregivers follow a hybrid care model so that they can also make periodic physical assessments. So this is a picture of someone offering a virtual caregiving. Volunteer caregivers typically will provide respite or hospice care. This type of caregivers usually will provide breaks for informal caregivers and assist with tasks such as companionship, support, and supervision. So that could be someone whose primary caregiving is provided by informal caregivers like family members, neighbors, cousins, aunts, and the likes. And a volunteer caregiver can come in once a week just so that day will be a off day for the informal caregiver. So that's what I mean by the respite period. Now there's some caregiving setting that is important to know. Geriatrics friendly emergency. One of the places where elderly people can receive health care is the emergency department of all hospitals. Now, emergency department visits can be very confusing and intimidating for everyone, even especially for elderly people. Children will have the privilege of being brought in by their own parents. Elderly people who do not have caregivers and who do not have children catering to their health and need to present at the emergency department of any hospital may find it a daunting experience because emergencies are quite loud and they can be chaotic. And the healthcare personnel usually are also very busy, so they can conduct a very quick initial evaluation. But the evaluation may likely be too brief to effectively cover the older person's chronic medical problems and medication. So, excuse me, a patient that has delirium, Alzheimer's, and the likes will not be able to give a detailed history. This is where a caregiver comes in to be able to fill in the gaps for the healthcare personnel so that the patient will be able to get the needed care that they deserve. So the caregivers will play essential role in supporting the older adults when they have a visit to the emergency department, even after. And usually they'll provide a support system, medications that the patient will be using will be explained to the caregivers, and some other necessary instructions that the elderly person may not be able to keep track of. So the place of the caregiver in an emergency setting is essential. Community-based care, older adults with disabilities usually can live at home with the help of their family and some special programs. These programs will provide health care and help older adults with some daily activities. So some caregivers may also work in so-called community-based care settings. Now, there's something called area agencies on aging. It's available in some countries, and these agencies usually will receive government funds to offer information and connect people with local services. They offer information on elderly persons who will need caregiving and then connect such people with the local services. And these area agencies on aging would also advocate for the needs of older adults, would assess their needs, would coordinate individual plans and services to meet these needs. And they'll manage local, state, national, private funding to offer home care, home modification for safety, meal delivery, transportation, respite care, which I said earlier, is like short-term breaks for the caregivers, and just the necessary support that both the elderly persons who would need caregiving and the caregivers would need. Now, adult day services are like daycare centers for adults, for the elderly people, and they will offer several social and support services to a group of older adults in the community. They may also offer health care. For example, a nurse may take a patient's blood pressure, help them take their medications. Often the people who go to these centers will need help with daily activities when family caregivers are working. They will need a short break. So the family member, maybe a son or a daughter who houses the elderly person, goes to work. The elderly person cannot be left alone unattended because they will need help with one or two things. So such elderly people are enrolled in adult daycare settings, and the caregiver comes and works in such a system. And some of these people would also have a program for older adults with dementia. So there's another entity called Program of All-Inclusive Care for the Elderly. And this will provide adults day services for the frail older adults that are 55 and older. So Program of All-Inclusive Care for the Elderly will serve people who will be in a nursing home if they do not have help. So now these persons, if not for PACE, they would have been in a nursing home. And the goal is to keep these adults in the community as long as it is practical. In the community with their friends, with their neighbors, with the life they've always known, rather than being moved to a nursing home that is like a boarding house system, so to say, for elderly people. And generally, older adults in PACE will spend most days at an adult day service center, and they would also get their medical care there. And a team of health and other types of service provider know the older adults well, and they can also care for them at home in some situations. So the services that PACE will provide include respite care, which I said earlier is a short-term break for the caregivers. In this case, many cases, the informal caregivers that are being provided by the family members. They will also provide transportation, just the same thing that the adult daycare setting provides. Medications, they will provide rehabilitation, including maintenance of physical and occupational therapy. They can provide hearing aids, eyeglasses, and some other benefits. So home health care includes services such as house calls that physicians, nurse practitioners, or physician assistants will make to a person's home. So there are some people who would have their own care and their medical personnel will come to their house to offer such care. And care that nurses, personal care aides, and rehabilitation therapists provide in the home of people with medical needs is also called home health care. And these staffs would often work from home health agencies. So there are some agencies who will have personnel working for them, who will then disperse them into various homes of persons who are their clients. Modifications to the home and technologies that help people with medical needs and disabilities are carried out daily here. Assisted living, that's another type of caregiving setting. Sometimes an older adult will need more help with personal care than they can get at home from their family members or other caregivers or home-based formal support programs. So such persons are admitted into an assisted living center because such needs cannot be met at home. Then this option can provide help to an older adult while protecting their privacy and their independence at the same time. Now, finally, nursing homes. Skilled nursing homes will provide medical health and personal care, as well as supervision to people who need it. Nursing home residents will generally have severely ill or disabled or cognitive impaired persons. So that could be problems with thinking, with learning or memory. Now, who are the people that live in nursing home? About one third of older adults will live in nursing home at some point in their lives. People living in them are often women aged 85 or older. A risk factor for admission include, there are several risk factors related to living in a nursing home. One is age. The chances of entering a nursing home increases with age. Someone with a low income who cannot afford their own personal caregiving care would most likely be enrolled in a nursing home being run by government or could even be run by a private facility. Then if an elderly person has few family members who are available or willing to provide the caregiving need, or if they have little social activities, then an elderly person who has significant physical and mental disabilities would likely be in need of a nursing home care. Then race and ethnicity, white persons are more likely than other groups to go into a nursing home because of the individualistic lifestyle of the average Caucasian group. The Blacks, the Asians still have a communal system that can take care of the elderly people more easily, though now it's beginning to also encroach even into the African and the Asian culture. Then geriatric syndromes such as frailty, frequent falls, pressure sores, dementia, etc. would also increase the risk of being in a nursing home. All right, thank you. I think with this we come to the end of this lecture. Thank you very much.